You don't have to be diagnosed as clinically depressed to have suicidal ideation or other symptoms of depression. So you can still exhibit symptomology of depression without receiving a full diagnosis. But that doesn't mean that, like Dr. Nirai said, we shouldn't pay attention to those symptoms, to what they exhibit. And, one of the really, when I first began studying and we were on the topic of suicide, and one of the things that I think is most relevant is it's an area where if you see someone or if you realize that someone has suicidal ideation, you do not pussyfoot. You just talk about it. The more you talk about it, the better it is for them, because it's when you bring it out in the open that it kind of opens, hopefully, their perspectives, their outlook, and it's really important. So if you know of someone who has been making veiled references to suicide where you have noticed ideation, don't be afraid to go in and say, hey, listen, this is what I'm hearing from you. Can we talk about it? Because it is the best possible approach to it. Silence and sweeping it under the rug does not work with suicide.